Good morning, sir. My name is Lo Xing Lee, meeting number 292935, and now we are from Group 3. Now, today we're going to present the ethical issue in the Malaysia medical sector.
Hello, my name is Harin Hui and my metrics number is 292974. Now I'll present about executive summary. The managerial ethic guide right and wrong behavior in the organizations, promoting the moral responsibility and social responsiveness. Ethic management involving the prioritizing the employee well-being, adhering to the law and upholding professionalism and company policies. The ethic management enhance the reputation, employee satisfaction and the growth, while poor decision cause harm. This study focused on the ethical challenges in the medical sectors, analyze the issue and proposing the solutions.
Good morning, sir. My name is Hon Jia Seng. My double matrix is 292932. Today, I want to talk about issue summaries. In issue summary, we have ethical issues and ethical theory. In ethical issues, we have fraud and description, discrimination and bias, traditional medicine practice, conflicts of interest, inequality in healthcare access, medical negligence, nurse manager experience with ethical issues, professionalism is healthcare professionals, confidentiality and privacy and organ transportation and ethical sourcing. We use ethical theory, which has theory of justice, utilitarianism, visual ethics, and technology ethics.
Number one issue, fraud and deception. In healthcare are unethical and illegal actions that harm the quality of care, waste resources, and erode trust in the system. Example include lying about service charge, inflating treatment costs, or submitting false insurance claims. These practices are driven by financial gain, complex billing system, lack of oversight, and institutional pressure like competition or corruption. Individual may also commit fraud or greed out of greed, desperation, or ignorance of ethical principle. From the ethical standpoint, deontological ethics consider fraud and deception morally wrong because they violate duties like honesty, integrity, and respect of patients' rights. Utilitarian ethics evaluate these actions based on their outcomes, which are usually harmful, such as financial loss and decreased patient care. Both perspectives agree healthcare fraud is morally serious but approach it differently. One focuses on principle and the other one on the result. Second issue, discrimination and bias. Discrimination and bias in healthcare involve unfair treatment based on factors like race, gender, or socioeconomic status, leading to unequal care and health disparities. Despite Malaysia's multicultural society, cultural and social bias persist, influencing diagnosis, treatment, and care quality. Deontological ethics view such behavior as morally wrong, violating fairness and respect for patient autonomy. Utilitarianism highlight the long-term social harm caused by this action, out, outweighing any short-term benefit. Both perspectives stress the need for fairness and equality to ensure ethical and effective healthcare.
Good morning, doctor. My name is Ang Chen Hui and my matrix number is 293117. The third ethical issue in medical sector is traditional medicine practices. The integration and the use of traditional medicine practices in Malaysian healthcare system bring unique ethical challenges. Malaysia, with rich of cultural diversity, comprising Malay, Chinese, Indian, and indigenous communities, has fostered a strong reliance on traditional medicine alongside modern medical practices. Hence, it presents several ethical challenges in the modern medical sector. A significant concern is the lack of scientific validation for many traditional remedies, raising doubts about their safety and efficacy. Unverified remedies may harm patients or delay efficiency of treatments, thereby violating these ethical principles. Another issue is the lack of regulation and accountability among traditional practitioners, which create risks for patients. The ontological ethics highlight the duty of practitioners to adhere to professional standards. When practitioners operate without proper oversight, they breach their ethical obligation to both their profession and society. The next point is patient self-determination, which often without full understanding of its risks and limitations of using these traditional remedies. Respect for autonomy requires practitioners to provide transparent and complete information, ensuring informed decision-making. The fourth ethical issue in medical sector is conflict of interest. Conflict of interest in Malaysian medical sector, where doctors face dilemmas between professional duties and personal interests, present significant ethical challenges. This conflict often arises when personal gains, such as financial incentive or relationship, compromise the ability to provide impartial and patient-centered care. From a deontological perspective, healthcare providers have a moral duty to prioritize patient welfare and adhere to professional standards. Other examples include fee splitting, whereby physicians are paid commission for referring patients to a specific service or a specialist where the referrer has a direct self-interest in the service, which is a betrayal of patient interest. In addition, confidentiality and transparency, which is an essential component of ethical medical practice, can be compromised when conflict of interest are present. Patients have the right to make informed decisions about their care, free from concealed bias and utilitarian motive on the part of their doctor.
The fifth ethical issues inequality in healthcare exists. Urban areas will have more advanced medical resources to ensure the health of the people and medical experts will relatively prefer to stay in city rather than in rural area. In the contrary, staying in the rural areas will not only make it difficult to carry out rescue operations due to the limited facility, but also their own safety cannot be guaranteed. According to the theory justice, everyone should have equal access to medical resource and opportunity regardless of region. From the perspective of the visual ethics, the government should possess visual such as compassion and fairness to address this inequality in medical resources. The sixth ethical issue is medical negligence. Medical staff fail to meet the prescribed medical standard which result in patients receiving medical or potential medical treatment. When this trust disappears due to the negligence of medical staff, people will criticize and hold accountable the professionalism of medical staff and begin to distrust the government's medical staff. The medical staff often fall into a dilemma that is whether they need to admit their mistakes directly to patients. From the perspective of the deontology ethic, medical staff should abide by strict standards, strive for the best standard for the interests of patients, and respect the self-will and the dignity of patients. Utilitarianism advocates taking certain safety measures and precautions to prevent negligence by medical staff.
Issue 7. The nurse manager face the ethical challenge in staff management, patient care and resource allocate, especially under the pressure. Deontology ethic emphasize that following the rules and maintaining the confidentialities, while utilitarianism focus on maximizing the benefit, such as resource allocate to those with the best survival chance. Virtual ethics highlight the importance of the moral characteristic, fair wages, and better working conditions to ensure the workplace harmony. This ethical framework helps the nurse manager navigate the dilemma while balancing the fairness, outcome, and integrity. The eighth issue, professionalism in the healthcare professional. Professionalism in the medical fields involving the behavior judgment and the skill that ensure the quality care and build trust. Deontology ethics emphasize that responsibility rules and confidentiality, while utilitarianisms focus on the maximizing the welfare through actions like staff training and prioritizing care for the high-risk group. Virtual ethics stress compassion and moral characteristics supporting the patients facing the emotional or financial difficulties. This ethics framework collectively strengthens the professionalism, enhancing the treatment outcome and the patient confidence.
Good morning, sir. My name is Nicholas Yi, 293492, and our next issue is confidentiality and privacy, which has seen a long time ago because every patient required to fill in their information before doing any checkup, and Malaysia is lack of any specific law in governing this health data privacy. And there are past articles which state that patients possess an essential right to view their medical records, which give them ability to make informed choices regarding their health care. And about that, our ethical theory, utilitarianism, suggests that allowing patients to access their medical records can enhance their happiness, but if revealing sensitive information may hurt them too. So, for our deontological, emphasize the duty of healthcare provider should protect patients' privacy and respect their rights. And on the other hand, for our virtual ethics, focus on the character traits of healthcare professionals and transparency and open communication with patients are the top prioritized by a moral provider. So next, I'll talk about organ transplantation and ethical sourcing. In Malaysia, currently facing a challenges of shortage organ donor in the market, which are high demand but low supply. This will lead to a situation of ethical sourcing. So there are two way of sourcing, which either illegal trade from black market or fairness allocation organ. If illegal trade from black market, normally poor people will become victims of donor. While fairness allocation organ, it took long time for them to waiting. Normally they will die during waiting. And we come to our ethical theory, which our first utilitarianism. This theory states that allocation organ can help for maximize the benefit of society with the safe life. But this situation normally will lead to negative practices, which is organ trafficking. And our deontology theory state that argue that individual right must be respected in all situations. For example, humans should not be deceived or coerced to donate their organ if they did not receive any correctful information. And our last, which is virtual ethic, healthcare provider and policymakers should show their care to both donors and recipients by encourage transparency of the process. And to conclude, I will summarize key points discussed for our first theory, utilitarianism. This theory is best used for issues which are fraud and deceptions, discrimination and bias, and last for traditional medicine practices issues. And for our next theory, which are deontological ethics, we think that fraud and deception issues for coming on discrimination and bias, medical negligence, professionalism in healthcare professionals, and also confidentiality and privacy is best used for this theory as we need to know our right and wrong, although it's not immoral morally. And for our third theory, which are virtual ethics, we think that it's good for issues which are conflict and interest, inequalities in healthcare access, nurse manager experiences, and confidentiality, privacy, organ transplantation, and sourcing. Because this theory is about moral character value, it's about character traits. And for the last beneficence theory, we think that it's best used for traditional medicine practices because it have talk about advantage and benefit it's bring on. Thank you.
A last ethical lesson. Ethics are essential in Malaysia healthcare, guiding professionals to maintain fairness, integrity, and compassion. Honesty, transparency, and fairness are critical to ensuring equal access to care and upholding the integrity of the medical file. Principles like justice and utilitarianism promote fairness, while professionalism and visual ethics stress integrity and compassion. Prioritizing patient well-being over personal or institutional interests build public trust, improve healthcare quality, and foster a harmonious society.